We are wrapping up Breast Cancer Awareness Month with emerging research on breast cancer risk factors. Joining us is Dr. Anthy Demestihas, Chair of Surgery Healthcare at St. Vincent's Medical Center, who is also an 8-year breast cancer survivor. Doctor, welcome.
Thank you very much.
All right, before we discuss risk factors, do you want to share your personal story? Do you tell your patients, and how does it impact them if you do?
I do share the story with my patients. I feel it gives them some degree of comfort to know that breast cancer can obviously affect anyone, regardless of who you are and what you do. I was diagnosed by a mammographic change almost 8 years ago, so I can't stress enough the importance of mammogram, because you can find cancers when they're very small in the early stages.
All right, doctor, what are some of the most common risk factors for breast cancer?
The most common risk factor is age. As we get older, the likelihood of developing breast cancer increases. But being a woman, reproductive cycle is important. Having never had any children, or having a child after the age of 30.
All right. Do most who are diagnosed with breast cancer have risk factors?
Almost all women have a risk factor of some sort, but it really depends on the degree. And it's just important to know what your risk factors are so that you can determine what the right surveillance is for you.
All right, we're hearing more about how societal changes are increasing the risk. Tell us about that.
As I mentioned, more and more women are choosing not to have children, and in the last 20-25 years, we as women have made different choices. It might even equate to the same thing as having your first child after the age of 30. You know, if our careers come first and you choose to start a family later, but these are things that have definitely made a difference in increasing the risk of breast cancer.
Interesting. All right, talk about low levels of vitamin D. Is that a potential risk factor?
More and more emerging research today is showing that vitamin D levels probably play a very significant role in the development of breast cancer. Vitamin D is important in breast health, breast tissue cell health. So if your vitamin D levels are low, then the tissue itself is not healing properly.
Excuse me, doctor. I'm starting to cough. Can you encourage people to get mammograms?
Absolutely. And mammograms save lives, and we've shown that over the years.
All right, doctor, thank you.